TruScreen is a breakthrough technology in cervical cancer screening, providing real-time reporting without the need for laboratory testing, offering women a more accessible screening method that minimises patient discomfort and offers immediate results. Cervical cancer continues to cause substantial morbidity and mortality in women worldwide, and a new system for early detection of cervical abnormalities is a welcome advance for women's health. This training video will guide you through the operation of the TruScreen device and is to be used in conjunction with the practical on-patient training your distributor provides. For this training session, please make sure you have a charged device, saline solution, and a single-use sensor with you so you can follow along as we guide you through the device operation. At the conclusion of the video training session, please ensure you complete the knowledge-based test to receive your training certificate. Part 1. Introduction to the TruScreen device. The TruScreen system consists of the following: a portable handheld device, HHD, an intelligent cradle, an optical test plug, OTP, a HHD tip protector, an AC power adapter, TruScreen instructions for use, IFU, a TruScreen fibre cleaning kit. For each patient examination, you will require a single-use sensor, SAS. The TruScreen device can be operated with or without Wi-Fi. The LCD screen guides the user through the patient examination. Screening typically takes 1 to 2 minutes, with an immediate normal or abnormal result provided. If operating without Wi-Fi, the results will need to be manually recorded on the patient report pad or the clinic's internal system. If connected to Wi-Fi, the results will automatically be recorded. For more information on using the device connected to Wi-Fi, please see your IFU. TruScreen is contraindicated in patient use for certain conditions and should only be used on a normal-looking cervix. It should precede any other cervical procedure, including Pap smears. Please refer to the IFU for the full list of contraindications and further information on intended use. Part 2. Pre-screening. Prior to conducting the TruScreen exam on a patient, a series of questions must be asked in order to confirm the patient is suitable for the test. If the patient answers yes to any of the contraindications in the pre-screening checklist, they are not eligible for the exam. All information must be recorded on the patient report pad or in the browser. Take down the patient details, symptoms, and any additional comments. Part 3. Setting up the device. If your device has not already been set up, please take it out of the box now and follow us along as we guide you through the setup procedure. When initially setting up the device, plug in and turn on the intelligent cradle at the wall power point. You will observe a green light turning on at the top of the cradle. Place the OTP in the docking recess of the cradle. Place the HHD on the cradle for charging and wait for the HHD to turn on and run through the initial startup tests before settling on the Ready screen. The LED light on the cradle will flash between green and blue when the handheld device is docked correctly and has entered charging mode. The device will heat slightly during the charging cycle. This is normal. Please ensure if the device has been charging on the cradle overnight that it is removed a few minutes prior to beginning the first screening of the day. Please have your TruScreen device, SAS, and saline solution ready so that you can follow along for the remainder of the training session. Once your device is switched on and ready to use, you will see the initial Ready screen with the HHD's identification number and an audio button on the left bottom corner. For training, please ensure the volume is on. You can see the charging status on the top right corner and the Wi-Fi status on the top left corner. Press the arrow to move to the next screen. On the patient report pad, record the UID number that appears on the screen. This is the unique identification number for the exam. Press the tick on the bottom right corner to continue. The HHD will then proceed to self-test to ensure the device is functioning correctly. Without any input, the self-test should pass and automatically prompt you to begin the OTP test. Remove the tip protector from your HHD. You will see light coming from the tip of the handheld device. Remove OTP from cradle. Place the HHD tip into the aperture of the OTP until it gently touches the base. The OTP test will pass within a few seconds. If nothing happens after a few seconds, the LCD screen will alert the operator. Rotate the bottom half of the OTP following the direction of the arrows and try again. Once OTP test passes, remove tip and immediately place the OTP in the docking recess on the cradle. Avoid placing the OTP on benches or other surfaces. A Fit SUS screen will appear. Open a fresh SUS and mount on the HHD, taking care not to touch the tip of the HHD to the SUS. Pull back firmly on the SUS to ensure the electrodes at the tip are lined up, and secure the tab on the underside of the SUS to the handheld device. Once correctly fitted, you can start the SUS fit test by pressing the arrow on the screen. Ensure the SUS fit test is performed away from direct light and reflective surfaces. Once this test has passed, the LCD screen will show SUS pass and then start screening. Should you see a SUS fail screen or the fit SUS screen has not changed, please ensure the SUS has been correctly fitted to the HHD and then restart the fit test by pressing the back arrow. The device is now ready to begin a patient examination. The device self-tests are a simple procedure carried out before each exam to ensure the device is operating correctly. When conducting the OTP test, it is important to keep the following steps in mind. Do not place OTP on benches when not in use. Always return the OTP to cradle. If there is an OTP test fail, rotate base of the OTP following arrows and retry. Similarly, for the SUS fit test, you must remember to use a fresh SUS for each exam, mount SUS on HHD and pull back firmly, secure SUS tab to underside of HHD. If the SUS fit test fails, check you have correctly fitted SUS and retry. Part 4. Patient Examination. Prepare the patient for a standard gynecological examination with appropriate lighting. Ensure the patient is in a comfortable position that allows for good visualization of the cervix. Deep placement of the speculum is required to provide good visualization of the cervix and partial eversion. If a speculum lubricant is required, please ensure it is not transferred onto the patient's cervix. If excess mucus or blood is present that doesn't allow proper visualization of the cervix, use ring forceps or cotton balls to remove the excess prior to the TruScreen examination. Avoid cloth gauzes as this may scratch the surface of the cervix. Press the arrow to commence the examination. For this part of the training session, you will simulate the examination process using a saline solution on your palm. Please follow the outlined screening steps using your device to take spots on your palm in place of the patient's cervix. You will start the patient exam by inserting the tip of the HHD mounted with a SUS into the vagina and gently placing the SUS tip onto the patient's cervical tissue at the 9 o'clock position on the left side of the cervix as per the probing pattern. The LCD screen will show spot 0. Using very light pressure, place the SUS tip against the patient's cervical tissue and steadily hold until the processing spot is complete and you hear a beep accompanied by a green screen. Lift the tip and continue to screen the surface of the cervix, being replicated by your palm following the probing pattern. Try not to overlap or miss any of the spots. It is important, even on a suspicious area, to not overprobe any spots, as this can cause inaccurate results. If there is a failure to read the spot, the LCD will alert you with an error screen. Ensure you are not moving the tip of the HHD while the spot is being analysed. Gently change the angle of HHD and ensure the tip has good, light contact with tissue to redo the spot. It takes 1 to 2 minutes to complete the examination, probing an average of 18 to 22 spots to cover the whole size of the cervix, following the prescribed probing pattern. The maximum spots for an exam are 32. The exam will automatically terminate if the maximum is reached. Once you have probed the entire reachable surface of the patient's cervix, press on the arrow at the bottom right corner to terminate the exam and continue to the results. For this training session, please complete a minimum of 15 spots on your palm. Once you have completed 15 spots, press the arrow on the LCD to continue. The LCD screen will then prompt you to confirm coverage. The objective screening result will be shown on the LCD screen immediately after confirmation. When operating the device without Wi-Fi, the exam results need to be recorded manually. Once this is confirmed on the LCD screen, press the arrow to confirm the end of this examination. The LCD screen will go back to Ready mode for the next exam. Remove the sus from the HHD and dispose of it as per local requirements. Put the tip protector back on and mount the HHD on the cradle. The TruScreen device is a primary screening tool and is intended to assist the physician or clinician. It is the physician's responsibility to provide the final clinical diagnosis and treatment to the patient based on all the information that they have available. If the reading is normal, this means no precancerous lesions found on the cervix, so the patient can return for the next screening test as per the local screening guideline. If the reading is abnormal, just as with other screening methods, a colposcopy or other diagnostic procedure, as prescribed by your local guidelines, will need to be conducted to confirm diagnosis and patient treatment plan. When using the TruScreen device, it is important to keep the following steps in mind. Record patient information and complete pre-screening checklist. Do not continue with exam if patient is contraindicated. Record the unique identification number at the start of the exam. Ensure the sus is correctly fitted. During the examination, keep a steady and light contact with cervix while each spot is processing. Lift the tip from the cervix after every spot. Carefully follow the probing pattern, covering the whole cervix, being careful not to overprobe any areas. After exam, dispose of used sus in line with local requirements. Replace tip protector on HHD and mount on cradle ready for next exam. Part 5. Device maintenance. It is important to clean the TruScreen HHD at least twice a day when in clinical use. Make sure the provided cleaning wipes are easily accessible and that the isopropyl spray is in close range so the device can be cleaned as required. Take out one wipe and spray with the cleaning solution. Remove the tip protector from the HHD and gently clean the lens on the tip of the device with the wipe. Dispose of wipe and replace the tip protector on the HHD. The TruScreen device requires recalibration. Every 18 months, the device will alert the user of this requirement. Please contact your distributor when this alert is seen. The TruScreen IFU provides further information on the use and maintenance of the device, including event screens and troubleshooting. Users should ensure that they always keep a copy of the IFU with the device. Please complete the knowledge-based test at the conclusion of this video. For more information about TruScreen, visit www.truscreen.com.